Welcome back. You're watching News Center. Now, as promised, we're joined by Dr. Gichui Kariuki, who's the director of Wonder Peace Wellness Center. His specialty is in substance abuse, and he's going to help shed light on the situation in the country and perhaps what needs to be done from a national level to a county level. Earlier on, we heard from Clement Masombo, who told us of the cracking a whip or a nyeri of the illicit brew, if I can call it that, or rather illicit alcohol that may have been linked to some of the incidences where people got poisoned after consuming alcohol that had not gotten the green light from the authorities that are meant to check and put checks and balances in terms of standards. Now, Dr. Kariuki, at the county level, what is the situation as far as substance abuse is concerned, and how is it linked to mental health?
Thank you very much, Trix. Yes, now when we consider the counties, I'd rather start by painting a picture of the national picture of the levels and the prevalence of substance use disorders in the country. So when we're talking about a national prevalence of about 30% when it comes to alcohol use, and we're talking about a level of about 2.5% when it comes to use of mixed use of alcohol, bang, and Mira, and we're talking about prevalence of about 0.3% when you talk about bang use only. Now, when we wrote, that is a picture that can that generally portrays that these disorders are something that need urgently to be addressed. Now, when we talk about regions and counties, there are some counties that have had a more that are battling with a more prevalence than the others, where in particular we'll be talking about the Mount Kenya region, Nairobi, Mombasa counties, where we find that the prevalence here sometimes is significantly higher than the national prevalence, where like in some counties, say for example in Nyandarua County, where there are statistics that are quite scary of about 75% of use of alcohol among the population, and in Kirinyaga County where we have 51%. So as you can see, Mount Kenya region is hugely affected by this problem, and measures to mitigate the substance use disorders as well as mental health have been slightly falling behind of the rate at which that they're supposed to be upscaled.
Okay, now what you've explained right there points to a situation where there's differences depending on what region. Some are having a bigger problem with substance abuse than others, and this means that the solutions might be as well unique, or should be unique to the areas. So whose responsibility is, you've painted a national picture and a county government, or rather county picture, whose responsibility is it to ensure there's a crackdown on substance abuse, and what approach should county governments be taking in handling this matter?
That's a very good question, Trix. So this is a national problem as well as a county problem as well as a local problem, in the sense that substance use disorders, as with most diseases, require the participation of all members in the healthcare sector, as well as stakeholders, which include the societies, the private facilities, which include the Christian and religious-based organizations. So now when we look at it from a national perspective, we do have organs that have been created by, to handle this problem in a national scale. That would be NACADA, for example. And it is upon them to do, and it is their responsibility for the huge part to handle the substance use disorders problem nationally. However, as we know that since the devolution of health, it has become a matter of urgent need that that health institutions as well as healthcare providers on the county level be how would I put it? Be properly facilitated to provide the care for the patients who fall in their jurisdictions. So, that being said, it means that the strengthening of the healthcare system from a county level, that means from the level 1 facilities in the handling of mental health issues, has to be upscaled.
Yeah, as we talk about that upscaling, what should it look like? Is it an increase in funds? Should it be better facilities, understanding the problem at the grassroots level, or even just having data that supports the need for this kind of upscaling?
Well, the upscaling should be done systematically. This means that when you look at it, at the way we are supposed to be handling the mental health problem, it should be in terms of systems, whereby the spread of information and the increase in knowledge of the public on the problem of mental health, as well as the strengthening of mental health in the grassroots levels, meaning that means that you build the capacity of healthcare workers in the level 1 and the primary healthcare systems all the way to the tertiary healthcare systems. This means that we're educating our community health workers and enabling them to build their capacity when it comes to dealing with mental health issues from the grassroots level. And this also ensures that you have a robust referral system that sees the patients who require tertiary care getting it, rather than having patients travel large distances, spend a lot of money just to have care that should be provided at the grassroots level.
Okay, and as we seek to understand this problem, one of the major issues that are faced by people who are seeking help, this kind of help, has to do with the cost. You are a director of a center that is meant to improve wellness. I mean, what can be done? Because most of these facilities have extremely high bills for people who are just seeking wellness. What can be done?
That is quite true, Trix. The cost of treating mental health disorders can be quite high. We will take, for example, just the cases where you have patients who require rehabilitation in terms of inpatient rehabilitation for substance use disorders. They will spend a period of, on average, 3 months in these facilities, and this whole time they're incurring bills. The protection of the public against financial distress due to these bills should be a function of the national government. In that, by what I mean by this is that the ensuring that substance use disorders and mental health are considered and factored in the disbursement of NHIF and the provision of NHIF's funding for these disorders should be something that is very high in the priority of the national government as well as the healthcare system.
All right, and as we finish, what more would you like the people watching to learn about substance abuse, and especially as pertaining to mental health?
First of all, I would like for people to understand that substance use disorders is a disease. It is a disease and a chronic one. Just the same way that you would put a lot of effort and care to somebody who's suffering from diabetes, hypertension, and other chronic diseases, the same amount of care is required for these patients. And because these disorders have been proven to be to have a very good success rate when it comes to rehabilitation, once the proper measures are taken, we will have this problem of mental health disorders and substance use decrease quite rapidly, should we put in the proper infrastructure and should the communities be made aware of these disorders. So once a patient, or if you know of anyone who has who is suffering from mental health disorders or is suffering from substance use disorders, let's try and reduce the stigma. Seek help. There are many institutions. We have a blanket of rehabilitations that covers the whole country, and we have a system of referral from a centralized position which is called APRAC. So should you find yourself in need of these services, do not shun away from looking for this help. There are people and there are many institutions that are willing to provide this help to you and to your people and to your loved ones.
All right, a little empathy goes a long way. That is Dr. Gichui Kariuki, Director, Wonder Peace